So, good morning, everyone. It's 255 days later. We're now in the 37th week since we had our first case on March 12th of COVID-19. As of today, we now have 4,954 positive cases of coronavirus since it started. 2,061 people are currently under mandatory quarantine. We have an increase today of 112 positive cases overnight. We had 1,396 new positive cases since this started November 1st, almost 1,400 in 20 days, which is really alarming. That's over 28% of our total positive cases since the outbreak began this month alone, 28%. Think about that for a second. Over a quarter of all our positive cases started more than 8 months ago, and 28% in 28 days. Yes, more people are getting tested, more testing is available, but it's here. We're in the second wave, and we need to continue to do the right thing. We need to have people continue to wear a mask, cough into their arms, clean their hands, and stay 6 feet apart. Of the positive cases today, 23 had close contact to positive cases, 5 healthcare workers, 2 people reported traveling, and a whopping 82 people didn't have a clear source of infection. And that's what we're talking about, 82 people. The information you provide to contact investigators and contact tracers is totally and completely private. It's not going anywhere. It's private. Help Dr. Whalen and her team do their job. I was happy yesterday when we went down to 56, or 2 days ago, we went down to 56% of people not being, this number, and now we go back up. 82 people can't tell us where they got it from. It only helps us stop the clusters, it only helps us stop the spread, and to do our job. So please help us help you. So as today, 20,462 people, like I said, have completed the quarantine, and of those, 4,124 tested positive for the virus have recovered. As of today, 72 new recoveries since yesterday. There are currently 45 people in the hospital, 2 new hospitalizations overnight, with a hospitalization rate of 0.90% of those tested positive yesterday, and the rate was 0.92%. And like we said, we hit an all-time high with our hospitalization, but you got to remember, we gained 2 yesterday, 2 people got discharged, it goes ups and down, but it's alarming to have 45 people. So with the milestone of the 45 people, like I said, that had the virus, topped our 44 set on Wednesday. 12 patients currently in the ICU, it went up 2 since yesterday. So it was 10 yesterday, today it's 12, so 2 more are in the ICU. Over the last 5 days, there's been an average of 89.8% of new positive cases each day. Yesterday, it was 81. I also want to bring attention to Albany County's percent positive rate, since this will decide whether or not we enter a yellow microcluster zone, which requires a 7-day average of over 3% over a 10-day period. Between November 12th and 19th, our 7-day percent positive average based on the New York Forward county by county dashboard is 2.9%. Yesterday, we saw a dramatic increase in the number of people tested, and fewer have come back positive, which is a good thing. People are doing the right thing. And I do want to emphasize, thank you to everyone doing the right thing and continue to do the right thing. I know everyone thinks we just get on people not doing the right thing, and I think Dr. Whalen will concur when she speaks that there are a lot of people out there doing the right stuff, socially distancing, not gathering, only going out when you have to. So thank you for that. So because of the average drop below 3%, the 10-day count resets, and the count will start again over a 7-day rolling average of 3%. If in a yellow zone, a buffer zone, schools remain open, but 20% of the students, teachers, and staff must be tested every other week. This is separate from testing that we announced earlier in this week for students taken out of school because of symptoms, so this is a little bit different. Also in the yellow zone, houses of worship are limited to 50%. Mass gatherings are limited. Both indoor and outdoor dining restaurants are limited to 4 people at a table. And we'll get a little bit more into the microcluster, and I'll have my deputy Dan Lynch talk about that in a little bit. But I want to say again that we aren't there yet. We are hoping to stay out of the yellow zone, and but we need to be careful. And the only way we're going to do that, again, is working together and doing the right thing and staying in a partnership like we've been doing. The sacrifices we're asking people to make are annoying and frustrating. I get it. I really do. I know, and it's not easy, but people have COVID fatigue. I get that also. But I think we have to look back over the last next year at the sacrifices we each made to prevent people from getting sick, possibly dying, and prevent other ones from possibly dying or getting COVID-19 if we continue to do the right thing and work together. And again, I do want to thank the people that are doing the right thing and continue to do the right thing. I know many people are already making sacrifices when it comes to Thanksgiving and other holidays and getting together. And I talked to someone the other day that hasn't had contact with their parents in 8 months. You know, thank goodness for Zoom or FaceTime or, you know, just standing outside their window. And it's tough. And she almost started crying because she said, I just miss hugging my father, but he has underlying health issues. And he got through cancer and has diabetes, and I don't want to see him sick. It's tough, trust me. I think everyone we have in our nursing home that they can't see their loved ones, it's been 8 months, started to, and then you got the rolling average, and then you got if somebody gets positive out there, a worker or a resident, it goes back to 28 days. It's tough. It's not only just tough on our workers out there, but on the residents that, you know, people want to see their loved ones. But we need to continue to stay vigilant. We need to work together. We need to be resilient, and we'll get through this working together. So I just wanted to remind everyone, please, you know, go to our new map feature on Albany County website. You can make it easier than ever before to locate the different testing sites that are available throughout the county, wait times, everything else like that. So please go there. You can see where kids can get tested versus just adults, rapid testing versus the regular testing. And again, to remind everyone, UAlbany is free. And Whitney Young is free if you don't have insurance. The other places do take your insurance card and you'll end up paying. But you got two options if you can't pay, Whitney Young or UAlbany. So again, go to our website and you can see all that. And again, you can call UAlbany at 1-888-364-3065 or Whitney Young Testing at 518-465-4771. Again, please, we're in this together and we'll get through this together, working together. Dr. Whalen.
Thanks, County Executive McCoy. So, you know, as our numbers continue to go up, we continue to assert the importance of the public to continue to be very proactive in how you protect yourself and how you protect your family. For many people in Albany County, up to now, those numbers have just been something that's not personalized, something that may not mean a lot to you. But as the numbers go up, it is likely that you now know someone or will soon know someone who is affected by COVID. In young, healthy subjects, healthy patients, we know that it is likely that this may be a mild illness. You may also be aware of people that unwittingly affected elderly relatives who didn't fare as well. This is what we're trying to prevent. We know our hospitalizations are coming up, and we are going to be incorporating that data into a similar curve that you see for the daily cases so that people really get a representation of how this is affecting our hospitals. As you know, to be admitted to a hospital, you need to require pretty serious care. This is something that we are seeing spreading at a very concerning level. Particularly before the holidays, it is important that everyone use this information to inform their holiday plans. It's a sacrifice. It's a sacrifice for me personally. It's a sacrifice for everyone you see here. I would love to get together with my parents. I would love to get together with my sister and brother and their children. This is what we do every year, and this year it's not going to happen. It's a big challenge. But I really urge people to look at the flip side of that coin and weigh very carefully how you would feel in 2 weeks' time, knowing that somebody in your family may have unwittingly affected an elderly relative, and knowing that that individual is either hospitalized or, as we are seeing, unfortunately, people are dying. That's something to think about every day. We are working very closely with our schools on preparing for a microcluster strategy, and this will be a challenge for them to do things that they have not previously done before. They, as I've indicated all along, have been working very well to protect and prevent transmission within their institutions, but those children are only in the school for a short portion of their day. And we know that kids are still doing a fair amount of socializing. A lot of this is due to the fact that, we have had a reopening. We are not shut down like we were in March. And there is what the popular press has now termed COVID fatigue. People are sick of it. I understand that. I'm sick of it. I think we're all sick of it. But it is not a reason not to double down. If you look at the graphs, if you look at the numbers in Albany County, you'll see that our numbers are higher now than they were in the spring when we shut down. When we are reaching out to people, I believe the vast majority of people that we reach out to are giving us accurate information. And most people that give us information on contacts have a lot more contacts than they did in the spring because they're out and about. Some of these things are by necessity if a child is in school. Some people have to go to work in person. For those that don't, I continue to encourage businesses to look at alternative plans so people can work from home and prevent their risk. But we are seeing a lot, too, of still people having get-togethers, and there are a lot more people that can come into contact. So it is very essential that people weigh those concerns before they go out the door on a daily basis. I think this is going to get worse before it gets better. The numbers continue to rise. As we've indicated, we are heading into flu season. We continue to urge people to get flu shots so that we don't have the dual problem of influenza and COVID. Please continue to follow the advice. Please continue to be vigilant, and remember that everything that you do to protect yourself and your family can also protect another life. Thanks.
Thank you, Liza. Dan Lynch is going to talk a little bit about the microcluster zones.
Thank you, County Executive. So this is a complicated area that needs education, and we are receiving our education through our contacts at New York State and certainly through the regional control room. We had a very informative conversation yesterday afternoon in that control room, specifically in regards to the microclusters and the metrics that are associated with it. So for the County of Albany to try to simplify what this means for us, we're currently on a steady march in the wrong direction towards that 3% threshold for a 7-day rolling average of infection. And as the county executive mentioned, currently the 7-day rolling average is 2.9%. So as you can see, we're right on the doorstep. We fit into, through the metrics, the county itself as a tier 2 indication, tier 2, which means that we need that 3%. However, the city of Albany is a tier 1, which lowers the threshold to get into a cluster zone. Their infection rate would be 2.5%. So what we have asked and are partnering with the state on and working with the state to figure out where in fact the infection is occurring throughout the county, and if so, where within the city of Albany, so that we can work accordingly in making sure we do our part in educating that community before we get to those thresholds. So once you have the qualifying 7-day rolling average, whether it be 2.5% for the city of Albany or for the county 3%, you then start a 10-day window. Each of those days, as you go through that 10-day window, if you meet the 3% threshold, it's a qualifying day. You need 10 of those qualifying days to get into the first precautionary zone, that being the yellow zone. If in that 10-day window you have a day in which you fall under the threshold, let's say on day 5 you have a 2.0 infection rate, it would reset the clock of those 10 days. So that's important for everyone to know. But the numbers are what the numbers are. We're getting more testing, we're having more positives, but the rates are relative. We have right around 3% infection rate in the county of Albany to date. So we are right on the doorstep. I would ask everyone to continue to follow the guidelines. Just a couple comments. I had a conversation just the other night with my daughter, who's a 4th grader here in the county, and she said something to me that hit home. And this is not based upon her exposure to national media or local media. This is her observations as a 9-year-old living here in the county. She says to me, "Dad, people are done with COVID-19, but COVID-19 is not done with people." And that just, it kind of hit home. And it got me thinking about, looking through things through the lens of a school-age kid who have all these new guidelines to follow to safely go into the school and learn and have social interaction with their friends in a safe environment. And again, as I'm sitting there thinking about what that means, our school-age kids are doing their part every single day and wearing their masks and following the social guidelines, the safety guidelines to ensure that they're safe and the school environment's safe. And it's really not a big ask to ask responsible adults to do the same thing. And that's what we've been asking for months now. Wear a mask, wash your hands, cough into your elbow, stay 6 feet apart. If our school-age kids can do it, we can do it as adults. And I would ask you, as we daily approach this threshold of going into these zones, which are going to have some restrictions associated with them, let's not get there. Do your part, help us as a county and a community to stay out of the cluster zones and to keep things open in the way in which we've been operating for the last several months. Thank you.
Thank you, Dan and Liza. Thank you. It's again, we are in this together, and trust me, you don't want to get into the zones because it's hard to figure out how it's going to affect zip code, or it's going to be certain blocks, and again, it's something we don't want to get into. But I do want to say, on a positive note, yesterday we had a great Albany Food Summit. Mayor Sheen led it, and we talked with all the different places around, Catholic Charities, Salvation Army, PAL, United Way, Boys and Girls Club. I can just go on and on with the list, the Children's South End Cafe, about problems, just not when we talk about COVID-19, we talk about other things that are going to happen going forward. So it was a great meeting yesterday led by the mayor, and addressing the issues of people needing more and more food now than ever before, because we're in an economy crisis on top of everything. And talking about that, one thing I keep bringing up is the Adopt a Family program, the drive-through that we're having at the True Hotel by Hilton by Crossgates. It started today at 10, it goes till 2 o'clock. Socially distanced in a car. You can take a drive, get out if you want to get out of the house a little bit, and drop a present off to make a difference in someone's life. So everything helps, every little present helps, and trust me, it will go a long way, even if it's something that you think that no kid will like. Trust me, there's a kid out there that'll just be happy to have something to unwrap on Christmas morning. So please help us make a difference in someone's life. You can go to the albanycounty.com, our website, it's our Children, Youth, and Family, where Adopt a Family is, for the information. And as always, our mental health's available. Dan Lynch brings up a great point again, and as Dr. Well and I have said this time and time again, this just ain't affecting adults, this is affecting children. Please, people, take the time to talk to your kids, and I don't care if they're 3 or if they're 18 or if they're 30, you know, talk to your kids and just see if that they're okay. And again, check on that neighbor. You don't have to go in their house. You don't have to, you know, you can talk to them through the door if it's in your apartment complex, and just make sure they're okay and see if they need anything. Because some people are resilient and some people just don't want to tell people they need help. So pay attention, be that great New Yorker that we all are. And again, we're in this together. But our mental health support lines available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number is always 518-447-7716. United Way 211 in New York State hotline at 188-364-3065. Please reach out, and we're here for you. Be safe and do the right thing.